Hello, this is Dr. Emma Nichols with this week's edition of the new FDA Approvals Podcast, covering the week of March 4th through the 8th, 2024. First up this week, the FDA has cleared Dexcom Stelo Glucose Biosensor System for over-the-counter sale, a first in the agency's history for a continuous glucose monitor, or CGM. This clearance follows Dexcom's submission of the application on January 8th, 2024. The Dexcom Stelo sensor is designed for individuals aged 18 years or older who do not use insulin. This includes people with diabetes managing their condition with oral medications and those without diabetes who are interested in understanding how their diet and exercise impact blood sugar levels. The system, however, is not intended for individuals with problematic hypoglycemia, as it does not alert users to this potentially dangerous condition. Dexcom Stelo offers a 15-day sensor wear time and a software experience tailored for non-insulin users, with plans to launch the product in summer 2024. The FDA's clearance is based on data from a clinical study comparing the Stelo sensor against other integrated CGM systems. Also last week, the FDA approved Semaglutide Wegovy injection for the reduction of cardiovascular risk in adults with known heart disease and overweight or obesity. Specifically, the new indication is for reduction in risk of major adverse cardiovascular events. So that would be cardiovascular death, non-fatal myocardial infarction, or non-fatal stroke in adults with established cardiovascular disease and either overweight or obesity. This new indication marks a significant milestone as semaglutide becomes the first weight loss medication also approved to help prevent life-threatening cardiovascular events in this patient population. Semaglutide is a glucagon-like peptide 1 GLP-1 receptor agonist approved for use in patients aged 12 and older with obesity, as well as adults with overweight and the presence of at least one weight-related comorbid condition. This week's approval was based on a comprehensive placebo-controlled trial involving over 17,600 participants. The study demonstrated that semaglutide significantly reduced the risk of major adverse cardiovascular events. The approval was granted to the manufacturer Novo Nordisk. Also last week, the FDA has approved Juvederm Voluma XC, that's a hyaluronic acid dermal filler for moderate to severe temple hollowing in adults over the age of 21. This marks the first FDA approval of an HA dermal filler specifically for use in the temple region, addressing moderate to severe temple hollowing with results that can last up to 13 months with optimal treatment. This is the first HA dermal filler approved for use in the upper face, which is a significant unmet need among patients. Clinical studies have shown that more than 80% of subjects saw at least a 1-point improvement in their moderate to severe temple hollowing 3 months after treatment, with the improvement lasting for more than 1 year in 73% of cases. Upwards of 85% of clinical trial participants said they were satisfied with the balanced, well-proportioned, and symmetrical appearance of their face 3 months post-treatment. The FDA's approval of Juvederm Voluma XC was granted to Allergan Aesthetics, an AbbVie company. Also last week, the FDA has approved Nivolumab Opdivo combined with cisplatin and gemcitabine for the first-line treatment of adults with unresectable or metastatic urothelial carcinoma. The approval is based on the Checkmate 901 trial, showing significant improvements in overall survival and progression-free survival for patients receiving the combination therapy compared to those receiving cisplatin and gemcitabine alone. This is the latest approval for Nivolumab, a PD-1 blocking antibody used in various cancers. Nivolumab carries multiple indications for melanoma, non-small cell lung cancer, renal cell carcinoma, and others. The approval was granted to the manufacturer of Nivolumab, Bristol Myers Squibb. Also last week, the FDA has granted accelerated approval to zanubrutinib Brukinsa in combination with obinutuzumab Gazyva for patients with relapsed or refractory follicular lymphoma after 2 or more lines of systemic therapy. Zanubrutinib, a Bruton's tyrosine kinase BTK inhibitor, works by inhibiting BTK, a key molecule in the B-cell receptor signaling complex that plays a crucial role in the survival and proliferation of B cells. Obinutuzumab is a type 2 anti-CD20 monoclonal antibody that targets CD20, a protein expressed on the surface of B cells, thereby inducing cell death. The approval was based on findings from the phase 2 Rosewood trial, which demonstrated significant improvements in patient outcomes with this combination therapy. Zanubrutinib is manufactured by BeiGene Limited, and obinutuzumab is manufactured by Genentech. And now a word from the supporter of this podcast, Nascent Medical. Is your company in need of medical writing assistance? Visit nascentmc.com. That's nascentmc.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad board summaries, and more, all for the price of a single freelancer, but with a much wider selection and with a background in the specialty that you need. Nascent Medical, we're here so that you never have to be without excellent medical writing help. Also last week, the FDA has postponed its decision regarding the approval of donanemab, an experimental Alzheimer's disease treatment developed by Eli Lilly, and that's been postponed to a later date. This delay is due to the agency's plan to convene an unexpected meeting of external advisors to carefully examine the safety and efficacy data from a pivotal late-stage trial of donanemab. The exact date for this advisory meeting has not been disclosed by the FDA, indicating that a decision on approval would likely be deferred until after the current month. Originally, the FDA's decision on whether to approve donanemab was anticipated by the end of the first quarter. However, this timeline represents a postponement from previously expected approval date last year. The FDA's call for an advisory meeting underscores the critical and complex nature of approving treatments for Alzheimer's disease. Eli Lilly, the manufacturer, has expressed confidence in donanemab's, quote, potential to offer very meaningful benefits to people with early symptomatic Alzheimer's disease. Also last week, the FDA approved Tyenne, Tyenne, and that's tocilizumab AAZG. That's a biosimilar referencing Actemra for the treatment of several inflammatory and immune diseases, including rheumatoid arthritis, giant cell arteritis, polyarticular juvenile idiopathic arthritis, and systemic juvenile idiopathic arthritis. This marks the first tocilizumab biosimilar approved by the FDA with both intravenous and subcutaneous formulations. Tyenne is an interleukin-6 IL-6 receptor antagonist. The approval of Tyenne was granted to Fresenius Kabi, headquartered in Germany. Also last week, the FDA has approved Jubbonti, that's Jubbonti, as an interchangeable biosimilar to US licensed Prolia, denosumab, and then also Wyost, denosumab, as an interchangeable biosimilar to US licensed Exjava, that's also denosumab. And that's for treating certain types of osteoporosis and preventing bone events in cancer patients. This marks the first approval of interchangeable biosimilars for a RANKL inhibitor, where denosumab functions by inhibiting the interaction between RANKL and its receptor RANK. This inhibition is crucial in preventing osteoclasts, those are bone cells responsible for breaking down bone, from degrading bone mass in the body. Jubbonti is indicated for various conditions, including osteoporosis in postmenopausal women and men at high risk for fracture, glucocorticoid-induced osteoporosis, and bone mass increase in men receiving androgen deprivation therapy for non-metastatic prostate cancer. It's also indicated for women receiving adjuvant aromatase inhibitor therapy for breast cancer. Similarly, Wyost is approved for preventing skeletal-related events in patients with multiple myeloma or bone metastases from solid tumors, treating adults and skeletally mature adolescents with unresectable giant tumor of bone, and managing hypercalcemia of malignancy refractory to bisphosphonate therapy. Both Jubbonti and Wyost are to be administered via subcutaneous injection and can be used alongside calcium and vitamin D supplements to prevent or treat low calcium levels. The manufacturer of Jubbonti and Wyost is Sandoz. Also last week, the FDA has approved clobetasol propionate 0.05% eye drops for the treatment of post-operative inflammation and pain following eye surgery. This marks the first FDA approval for an ophthalmic formulation of clobetasol propionate and represents the introduction of the first new steroid in the ophthalmic field in over 15 years. Clobetasol propionate is a corticosteroid known for its effectiveness in providing rapid and sustained relief from pain and inflammation. This agent has previously been approved by the FDA in a cream formulation under the brand name Clobex, and that's by Galderma, for treating pruritus in corticosteroid-responsive dermatoses in adults. The eye drops have been developed using Formosa's proprietary APNT nanoparticle formulation technology, which allows for twice-daily dosing over a 14-day period without the need for tapering. The approval of the clobetasol propionate eye drops was based on the positive results from 2 pivotal phase 3 trials. The FDA's approval of this agent was granted to Eyenovia and Formosa Pharmaceuticals. All right, that's it for this week. Thank you so much for joining me. Please do tell your colleagues about this podcast, trying to increase the listenership here. Really excited to see we've done over 40 episodes and the numbers are increasing, so that's always good. But please do tell your colleagues. And also do check out learnamasstyle.com, learnamasstyle.com. There's lots of free downloads and got an exciting announcement coming up on there, depending on when you're listening. But check that out for good stuff to do with AI in medical writing and editing. All right, thank you. Have a great week.